My name is Dwight Richards. I am the Planning and Improvement Coordinator with the Portsmouth Health Department. Here in Portsmouth at the Health Department, we do recognize that crime is also a public health matter. And as such, it's something that we also have to be able to address collectively. Now, it is not something that we can rely on just the police department to address as being just a single issue for the police, because we also realize that when people are involved in crime, they're also neglecting their health, or there may be other components within health that is actually helping to drive that crime, driving those actions. So it's important for us here in the health department to actually see it for what it is, that it starts with looking at the social determinants of health, looking at that access to healthcare, access to education, access to the resources, looking at the social context in which people live, or even looking at the built community environments in which they live, and look at the impact that that may be having in their access to healthcare, but also is it driving them towards committing crimes. In order for us to be able to address this, among the things that we have to do is to be able to step out of our silos. We can't wait just for people to walk in our doors in order to be able to get healthcare, and that's all. At the health department, among the things that we do, besides providing band-aids and vaccines and addressing their healthcare needs, we're also looking at what are the other resources that we are able to connect people to. The way we do that is through partnership. We partner with various different community organizations. We use a platform called Unite Us in order to be able to connect people to resources. We reach out to our partners between the police department, Parks and Rec, or other healthcare providers within the community in order to be able to connect people, because it is through those partnerships, it is through collaborations that we are able to address people's needs, to be able to address the whole person and not their individualized complaints or their individualized needs, but to be able to address it from a public health perspective, which is looking at the health of the entire community.